Welcome to Ariana Institute's Continuing Education Program. This is Ariana Vincent, Nationally Certified Massage Therapy Instructor and Continuing Education Provider. At Ariana Institute, we offer a wide variety of online continuing education courses for the massage therapist. Visit www.arianainstitute.com for additional information or contact Ariana Institute at arianainstitute.com. We look forward to your participation in our online continuing education program. Thank you. Welcome to Ariana Institute's Craniosacral Therapy Continuing Education course. This is Ariana Vincent. We're delighted that you're choosing to study with us. The name craniosacral is derived from the system's associated bones. Included are the bones that comprise the skull, face, and mouth, and the bones that comprise the spinal column, which extend down to the sacrum. The first written reference to the movement of the spinal nerves and its importance in life, clarity, and bringing quiet to the heart is found in a 4,000-year-old text from China. In the early 1900s, the research of Dr. William Sutherland, an American osteopathic physician, detailed the movement of the cranium and the pelvis. Dr. William Sutherland originated cranial osteopathy around 1898-1900. Dr. Sutherland found that the central nervous system and the cerebral spinal fluid which bathes it have a rhythmic motion. The breath of life, the rhythmic motion of the central nervous system and the cerebral spinal fluid which bathes it, is produced by the body's inherent life force itself, which is called the breath of life. The breath of life, an essential blueprint for health and a basic ordering principle at a cellular level, has remarkable properties for maintaining health and balance. The breath of life was seen by Dr. Sutherland to be the animator or spark behind the involuntary rhythms of the central nervous system and the cerebral spinal fluid that bathes it. The cranium is the bony bubble that surrounds and protects our brains. The cranium is made up of 14 different bones. The keystone of the bones in the cranium is called the sphenoid. Cranial sutures. The coronal suture separates the frontal bone from the parietal bones. The sagittal suture separates the two parietal bones from each other. The lambdoid suture separates the parietals from the occiput. The dural tube is an important anatomical component of the craniosacral system. The dura is a tough membrane that encases the entire cranium surrounding the brain and spinal column. The dural tube has attachment points to the foramen magnum as it exits the cranial cavity, a light attachment at C2, and also a distal attachment to the second sacral vertebra. The dural tube is our most interior piece of soft connective tissue, and it houses the entire central nervous system, the brain, spinal cord, and cerebral spinal fluid. The cerebral spinal fluid circulates around the brain and spinal cord until it is reabsorbed by the arachnoid villi that are mainly located in the sagittal venous sinus. Flexion and extension. The movement of the cranial bones is described in terms of flexion and extension. During flexion, the cranium becomes wider from side to side and foreshortens from front to back. The entire body is affected by this flexion-extension phenomenon. Dr. John Upledger. From 1975 to 1983, osteopathic physician John E. Upledger worked at Michigan State University as a clinical researcher and professor. In the mid-1970s, Dr. Upledger started to teach his work to a group of students who were not osteopaths, and he generated the term craniosacral therapy based on the corresponding movement between cranium and sacrum. Over the years, Dr. Upledger has done a great deal to popularize craniosacral work around the world. In 1985, Dr. Upledger established the Upledger Institute, a clinical and educational resource center in Palm Beach Gardens, Florida. Part of the 10-step protocol of craniosacral therapy, analyzing the existing cranial rhythm, creating a still point in that rhythm at the base of the skull, rocking the sacrum, lengthening the spine in the lumbar sacral region. Part of the 10-step protocol of craniosacral therapy, addressing the pelvic, respiratory, and thoracic diaphragms, releasing the hyoid bone in the throat, addressing each one of the cranial bones. Craniosacral therapy has helped the following: migraine headaches, chronic neck and back pain, motor coordination impairments, central nervous system disorders, traumatic brain and spinal cord injuries, stress and tension-related problems. Craniosacral therapy focuses on impaired mobility of all bones related to the craniosacral system, impaired accommodative abilities, motion restrictions of the dural membrane system, the flow of cerebral spinal fluid and blood, and body-mind integration. Systems of the body that are positively affected by craniosacral therapy include the brain, spinal cord, autonomic control systems, visual, auditory, olfactory, and gustatory sensory systems, motor and motor coordination systems, and the endocrine system. There are 26 bones in the head, and they are all in slight rhythmic motion along with the CNS, CSF, membranes, and sacrum. The brain produces a fluid that circulates within the head and up and down the spine. This is called cerebral spinal fluid, CSF. Cranial flexion is also known as the inhalation phase. Cranial extension is also known as the exhalation phase. The central nervous system, brain and spinal cord, has an inherent rhythmic motion. The cranium and the sacrum work together as a unit. three layers of the craniosacral system. The outside layer is called the dura mater. The middle layer is the arachnoid membrane. The innermost layer, the pia mater. Cerebral spinal fluid functions, floating the brain so the effects of gravity are reduced by about 75 to 80%, serving as a shock absorber so the brain is not traumatized by striking the inner surface of the cranium during sudden movements of the head or body. Cerebral spinal fluid functions, providing nutrients to the brain and spinal cord, as well as the pituitary and pineal glands, both of which are enclosed in the craniosacral system. Cerebral spinal fluid functions, washing away metabolic waste products and toxic substances that have been deposited within and between the cells of the CNS. Cerebral spinal fluid functions, maintaining the proper concentrations of electrolyte substances, ions, necessary for creating and transmitting nerve impulses so we can think, remember, feel, and move. It is now known that under normal circumstances, cranial bones do not fuse together at puberty as was previously taught. Rather, they are in constant motion to accommodate the changing demands placed on them by the dural membrane as it adjusts to the rhythmical rise and fall of CSF volume. Aquacranial therapy is a water-based therapy developed by Rebecca Goff, a massage therapist and marine mammal naturalist, by combining lessons learned from studying the behavior of dolphins and whales with the model of craniosacral manipulation developed by Dr. Upledger. Dolphin-assisted therapy programs. A team of craniosacral therapists from the Upledger Institute began a therapeutic investigation with dolphins to determine the effects of craniosacral therapy on clients in the water with dolphins present. Craniosacral therapy addresses comprised tissue patterns surrounding and within the spinal column, adipose tissue, and the dural tube. Dr. John Barnes teaches that by combining the cranial rhythm with fascial tissue mobility, a trained therapist will be able to relate restrictions to the effects on the cranial system. Research findings support the existence of a craniosacral system and sutural movement. Childhood and adolescent conditions that have responded well to craniosacral therapy include attention deficit hyperactivity disorder, ADHD and ADD, autism, teeth and jaw misalignment, and asthma. Ways to build your craniosacral practice. Review your business success plan often. Find several successful mentors to work with. Choose your thoughts wisely. Associate with successful people. Energy is contagious. Since craniosacral therapy is extremely gentle work, the aged, the very young, and the infirm can be treated. This course has been brought to you by Ariana Institute. Ariana Vincent, LMT, MTI, NCTMB. Feel free to register for additional courses at www.arianainstitute.com, or you can contact Ariana at arianainstitute.com. Thank you.